Everyone, welcome to our channel. In this video, we are going to look at hantavirus in a clear and detailed way. This is not a very common disease, but it is important to understand because it can be serious if someone becomes infected. Many people are not aware of how it spreads or how to prevent it. We will go step by step and cover what hantavirus is, how it spreads, where it is commonly found, the symptoms it causes, and the practical steps you can take to reduce your risk. Hantavirus refers to a group of viruses that are mainly carried by rodents, especially mice and rats. These viruses do not usually affect the rodents themselves in a harmful way, but they can be transmitted to humans and cause disease. There are two main types of illness caused by hantavirus. The first one is hantapulmonary syndrome. This form mainly affects the lung. It is more common in North and South America. It can develop quickly and may become severe. The second type is hemorrhagic fever with renal syndrome. This form affects the kidney and can also impact blood vessels. It is more common in parts of Europe and Asia. Although these two forms affect different parts of the body, they are caused by related viruses and share similar transmission patterns. One of the most important things to understand is hantavirus is not typically spread from person to person. Instead, it is mainly transmitted through contact with infected rodents or materials contaminated by them. There are several ways this can happen. The first one is airborne transmission. This is the most common way people become infected. Rodents infected with hantavirus leave behind urine, droppings, and saliva. When these materials dry out, they can break down into very small particles. If these particles are disturbed, for example during cleaning or moving items, they can become suspended in the air. Breathing in this contaminated air allows the virus to enter the body through respiratory system. This is why activities like cleaning enclosed space such as storage rooms, sheds or cabins can increase the risk if rodents have been present. The second one is direct contact with contaminated surface. Another way the virus can spread is through contact with surface contaminated by rodent wastes. If someone touches this surface and then touches their mouth, nose, and eyes, the virus can enter the body. This type of transmission is less obvious, but still important to consider, especially in areas where rodent activity is common. The third one is through contaminated food or water. Food or water that has been exposed to rodents' urine or droppings can also carry the virus. If consumed, it may lead to infection. Proper food storage and cleanliness are important to prevent this type of exposure. The fourth one is rodent bites. Although rare, bites from infected rodents can transmit hantavirus directly into the bloodstream. Most types of hantavirus are not spread between humans. This means causal contact with an infected person does not usually pose a risk. Virus is found in many regions around the world, but the specific type of virus depends on the local rodent population. You are most likely to encounter it in environments where rodents live, such as rural and agricultural areas, forested regions, farms, storage buildings, cabins or houses that are not regularly used. Rodents can enter buildings through small openings, so even indoor space can become contaminated if proper precautions are not taken. The symptoms of hantavirus infection usually appear between 1 and 5 weeks after exposure. One of the challenges with this disease is that early symptoms are not very specific. Early symptoms are at first the illness may resemble common viral infections. Symptoms can include fever, fatigue, muscle aches, headache, chills, nausea, or vomiting. Because these symptoms are similar to many other illnesses, hantavirus may not be recognized immediately. The later symptoms are, as the disease progresses, more serious symptoms can develop, especially in cases involving the lungs. This may include shortness of breath, persistent coughing, difficult to breathe, chest tightness. At this stage, the condition becomes serious and requires immediate medical attention. Virus infection can be severe, particularly when they affect the lungs. In case of hantavirus pulmonary syndrome, the fatality rate can be relatively high, often estimated at around 30 to 40%. However, it is important to remember that the disease is rare and risks can be significantly reduced with proper precautions. Early medical care improves the chances of recovery. Preventing hantavirus infection mainly involves reducing contact with rodents and their wastes. The first one is controlling rodent access. This means seal holes and gaps in the building, store food in secure containers, dispose of waste properly, keep living and storage areas clean. Second one is safe cleaning practices. Cleaning areas where rodents may have been present should be done carefully. Avoid sweeping or vacuuming dry droppings. Instead, wear gloves and a mask. Spray disinfectant on surface. Allow it to sit for a few minutes. Wipe it with cloths or a paper towel. This reduces the chance of releasing particles into the air. The third one is ventilation. Before entering enclosed space that have been unused for a long time, open the door and windows, allow fresh air to circulate. The fourth one is personal hygiene. Wash hands regularly. Avoid touching your face after handling potentially contaminated items. Hantavirus is a rare but potentially serious disease that is mainly spread through contact with infected rodents and their wastes. Understanding how it spread and taking simple preventive measures can greatly reduce the risk of infection. Awareness and proper hygiene are the most effective tools for protection. If you found this video useful, you can subscribe for more clear and detailed educational content. Bye bye.